Hello and welcome, and thanks for joining us for a very interesting online discussion. This is one of two video discussions that have been put together as an initiative in collaboration between Croí and the HSE to mark International Men's Health Week, which starts on Monday, June 10th and finishes on Sunday, June 16th, which is Father's Day. The focus of this particular discussion is around physical health and chronic disease. And the purpose of the video is really to create an awareness of preventable health problems. And hopefully through the course of this discussion, you will hear of maybe small changes that men of all ages could make that will significantly improve their overall health. My name is Pat O'Donnell. I'm going to chair this discussion. I'm retired and now a volunteer with Croí, the Heart and Stroke Foundation in Galway. So let's go to the panel. I'll introduce the panel to you. We have Paul Gillen, who is the Health Promotion Officer with the HSE, Dr. Brian Higgins, a Galway-based GP, Liam McHale, who's a former Mayo Gaelic footballer and basketball star, and Patricia Hall, a cardiovascular nurse specialist with Croí. So maybe I'll start with you, Paul, and maybe you could just set the scene for us in terms of the overall context of Men's Health Week, the theme for this year, why it's needed, and why it's such an important topic.
Thanks, Pat. Yes, the theme for this year's Men's Health Week is called Restoring the Balance. And I presume this is very apt, given the fact that all aspects of our lives recently have been shaped by COVID-19. You know, and that has had major impacts on our lives. But so we have three key aims as part of the week. The first one will be to raise awareness of men's health issues at a time when men are trying to build their lives physically, mentally, socially, emotionally, and their jobs and relationships and so on, and to build resilience and stability back in their lives. The second aim then would be to support and encourage young men and boys to engage in healthy lifestyle behaviors, because we all know that health behaviors have a huge impact in long-term or chronic diseases such as heart disease, cancer, diabetes, mental health, all that stuff that we hear about all the time. And then the third kind of key aim would be to encourage men, if they have any concern around a health issue, that they would get it checked out and treated. Because ideally, we all know that if something is left untreated, that sometimes the outcomes are worse if it's left too late. And men often put things off and they worry unnecessarily about going to the GP, whereas in fact that might be part of the reason why men die unfortunately 5 years younger than women, why they have greater mortality rates across all the major diseases. And the sad thing is maybe it's not all their fault either, because sometimes like that when men, the way they grow up and the way they're conditioned and socialized, they're encouraged, that influences their attitude to their health. And that could be things like not ask for help, not share worries, to remain in control, to be stoic, and not to show any sign of weakness. And that sense of stigma sometimes can color how they cope with change or adversity in their life. And what they generally tend to do then is they generally tend to kind of adopt what are the socially recognized masculine behaviors, which could be like that, suppress all emotions, adopt negative health behaviors, don't go to your GP, self-medicate with alcohol and all that kind of stuff. So we, particularly at this time now in Men's Health Week, we are asking, we need to support men to break the silence, to break that hidden shame, so they can go and talk to the GP. And by talking to their GP, they will probably realize that there are countless men like them out there who are crushed, who are low, who feel down. But that by talking to their GP, they can now realize they burst the bubble of fear, to regain control, and like that they can offload that burden that's there on their shoulders. And just before we actually, I'm just going to pass over to you, Pat, because I know you took the brave step recently, or within a couple of years ago, to restore your own balance in your life. But just I would encourage people to stay to the end of the video, because we have some wonderful links and websites listed there that can support you to gain access. If you're worried about any aspect of health, that will be a great source of information for you. So please stay with us. Pat, you took that brave step, and we have to frame it as that a positive thing to go and
yeah. Absolutely. Thanks, Paul. And indeed, as you say, you know, men, we're not the best in the world for addressing health problems when we have them. Back in 2014, I was working. I was a very busy man. In fact, I was far too busy to get my health checks taken care of. I had a pain and I was in good shape. I was going to the gym 3 times a week. My diet was good. I'd stopped smoking 25 years earlier. I was getting chest pains periodically. I ignored them. Of course, it just said it's a muscle strain. And after about 3 months, I finally succumbed and said, I'm going to have to get something done with this. I went into the Galway clinic for a checkup, and I had what they call the widowmaker. The main artery on the left side of my heart was almost entirely blocked. My next event, according to my cardiologist, would have been a heart attack, almost certainly fatal. I had a double bypass, made a full recovery, I came back to work, and I'm in great shape since I retired 2 years ago. But for me, it was a great example of men who think they're too busy, they're too much on, they couldn't be done without, oh, I can't address my health. You go in there, luckily I did it before it was too late. But you know, it is very much, as you said, it's a stigma with men. And I'm sure maybe Brian, you could talk to us about that and hopefully talk about people maybe not coming in to see their GP and you know, being reluctant about addressing these health matters.
Thanks, Pat, for bringing that up. You're right. Men don't come to the doctor as often as women do. And even when you adjust for, say, pregnancies and reproductive issues, they still just don't attend as much. And you touched on the reason why. In my experience, there's 2 big reasons why men don't attend the doctor. The first is they're embarrassed. The second is they're actually just not prioritizing their health. They need to get home after work. They need to work late. They don't want to take the time out. They don't have time to be sick. And I think we can all understand that. And what we're always trying to do is get people to engage with their health a bit more. So many people come in and say, look, I'm sorry for wasting your time. And it's amazing how many people say that. And the truth is, you're never wasting the doctor's time. There's always something that can be improved. Even if the issue that you're coming in for is small and doesn't need treatment and is not going to affect you in any sort of way, you can say, oh, come here, how's your smoking? Do you need something to help you quit? How's that fungal toenail infection that's been bothering you for 15 years? Will we clear it up for you? How's the shoulder that's been at you? Let's get that sorted. And what's amazing is once men engage with their health, they actually then do tend to come to the doctor as often. Once men have an illness, if you like, or engage with their health, they do say, actually, do you know what? That was quite a good experience and I know what to expect. And I'd be delighted to go back because we can get some work done. I think the things that I see most often are heart disease would be the most common thing. About 1 in 4 people in their life will suffer from high blood pressure, which can lead on to heart attacks like Pat, or unfortunately strokes. The other things we tend to see are skin disease, really common. About 1 in 6 men will develop skin cancer at some point in their lives. About 1 in 7 men will develop prostate cancer. A lot of us will suffer with mental health issues at some point in our life. The thing is, when it comes to your health, you always want to engage early. A lot of these health issues, if you identify them early, they are so easy to treat. And sometimes you can affect them with small lifestyle changes because everyone hates the idea of going on tablets. And a lot of the time, if you do present early, cancers can be managed with a small surgery. Heart disease can be managed with diet and exercise. And even then, should somebody need a tablet, if you engage early and change your lifestyle, the doses that you need and the amount of tablets that someone might need are much less. Interestingly, COVID has affected how we're delivering healthcare. You know, we've had to make changes to keep our patients and our staff safe. And I think as well, people don't want to bother us during coronavirus. They feel that healthcare workers are under a huge amount of stress. The truth is, yes, things are probably more difficult, but we're still here and we still need people to come in. And if you want to reduce our stress and our workload, come in early so that the problems are easy to fix. Don't wait 6 months and hope that they go away and then present with a more complicated thing. And you know, if you have been waiting 6 months, don't be embarrassed about coming in, because that's what most people have done. And that's what we're used to dealing with. There's never a bad time to come in. Like when it comes to your healthcare, the only wrong thing to do is nothing.
And did you see, Brian, did you see a marked reluctance during the COVID-19 restrictions of people actually coming to see their GP?
Yeah, and we have. Thankfully, I think we're developing a new norm and we're getting used to living with coronavirus. But yeah, definitely. And people didn't come in because they were afraid we were too busy. They didn't think we were open, or they thought they might be at risk by coming in. We've made huge changes to manage people's risks so that it's safe for them to come in. And we just want people to know we're here for them.
Okay, thanks. Liam, maybe switching over to you into getting the perspective of a former sports star. And I know age, like the rest of us, age is catching up. But I love the quote from George Bernard Shaw that says, "We don't stop playing because we grow old. We grow old because we stop playing." And maybe you could talk to that in terms of the importance of keeping active in your experience as we age.
Well, I'd agree with that 100%. If I could still play, I would. And I'm 55 now, just gone 55. Some very interesting stats there from Dr. Bryan. A few things that would, make you be aware of what's going on. Obviously, I played basketball and football, guys, for a long, long time at the highest level. I probably would look back now and say I played for too long. I played inter-county football for 13 years, played club football up until I was 40, and played basketball, believe it or not, until I was about 49. So I kind of knew there was going to be aches and pains. Those aches and pains were there and I was still playing. But 2 years ago, I was diagnosed with arthritis in both knees, and I would have a very sore, stiff back, and it can become a big problem if I don't look after it and stay in shape. And I would imagine, Pat, that there's a lot of people, men around the country like me. You don't have to play at the highest level to commit to club football or club rugby or club soccer or club basketball and give it everything you have. And a lot of people do that, and they would have the same sort of problems that I would have. The situation I'm in now, I'm 6'5" and I'm 16 stone 4. I used to play in the latter part of my career about 16 stone 7. With the way my knees are now on my back, I can't afford to go up to 18 or 19 stone. I have to stay light and nimble. And the only way I can do that is exercise regularly, eat well, and then try and get those sleep patterns well. And now, anybody that know you will tell you I like to enjoy myself. I like to go for a few pints. I like to go out for dinner and stuff like that. But I do try and prioritize. Some sessions could be 20 minutes, some could be 40, some could be an hour. But I think you got to get out there, even though you might have knee pain or back pain, you got to get out there and go for a walk. You got to get out there and stretch. People are driving for a living. People are sitting in front of a laptop for a living, and they're just seizing up. And lots of my friends would have, a bad knee or a bad back or a bad shoulder that Dr. Bryan talked about. And that kind of makes them sink into themselves. And I would say to them, you got to get through the pain barrier if you can, as long as your doctor allows you to get out there, and you have to exercise. And I find that then it kind of happens naturally, that the whole thing comes together, that if you're exercising regularly, even if it's only a walk or a cycle or a swim, that you then become aware of your diet and you then start sleeping better. And I think it all comes together that way. So
sorry, Liam, what do you think of the barriers for people maybe who were active and are now no longer active? What are the barriers, and how do they overcome those barriers to get back into a more active lifestyle?
Well, I think, again, we're back to guys coming home late, tired, maybe a sore knee, a sore back, all those sort of things kind of prevent you from wanting to go out and do something. Also, it's very, very difficult. I was just going to say to you there, Pat, I get up some mornings and my knees are killing me. I can't get down the stairs. So that day I have to make an adjustment and maybe just go for a cycle or something. But I think I've learned through all the sport I played over the years that sometimes it's not that simple. And I would encourage all the guys my age and maybe younger just to get out there, get through that pain barrier, get that first, month, 30, 45 days over with. And you will start feeling better. You'll start dropping a few pounds. You will be aware of your diet, and your sleep patterns will get better. You have more energy, more enthusiasm for life. And when you get to our age, it's really, really important to try and get that mindset back. They were committed when they played their club football or club basketball. Now they have to try and go back to the way they were and develop that mentality again, because it's of the utmost importance, those three things. And another thing I find is that when you do get guys my age back working out, they tend to go to the gym and lift weights, and they start worrying about their shoulders and their biceps and their triceps. And then you have to talk to them about this cardio. Are you getting enough cardio in? Because I guess the most important muscle you have is your heart. And some people don't even realize that. So you got to get the heart pumping and get that heart rate up and mix your workouts, you know, do a cardio session one day, maybe do a weight session the next, maybe go for a cycle, go for a walk. But you got to get that balance that you talked about, Brian, get that balance in and mix up your workouts. And then I really do believe that the diet and your sleep patterns and everything will come together because of that.
Thanks, Liam. And that the reference to getting your heart rate up and all of that, and talking about hearts, maybe I'll switch to you, Trish, and talk about cardiovascular disease and aging and how, you know, small lifestyle changes can actually prevent a lot of the issues that arise with cardiovascular disease. And given the fact that it is a huge problem for men, or for everybody, in terms of, I think 30% of deaths come from cardiovascular disease.
Absolutely, Pat. And one of the greatest public health successes is that we are aging and living longer than ever before. And good to hear Liam saying about promoting physical activity as we grow older, because we know how important it is. But as we get older, certainly age-related cardiovascular disease becomes more prevalent. And that's heart disease and stroke, and probably the most common kind of things we hear about are heart attacks and that. But we're also looking at high blood pressure, heart valve disease, heart failure, atrial fibrillation, diabetes. And these kind of conditions are not exclusive to men. Women certainly are affected for sure, but men face a greater risk of heart disease at a younger age than women. And also we see men develop heart disease maybe about 10 years earlier than, on average, than women do. And that first heart attack, which is the most common kind of presentation that we see of heart disease, strikes men usually in and around 65, but throughout life, heart attacks are twice as common in men than women. So it's not insignificant. When we look at the risk factors then for heart disease and stroke, about 1 in 4 men compared to 1 in 5 women have high blood pressure. We're seeing now about 70% of Irish men who are overweight or obese. Again, major risk factors for high blood pressure and diabetes and that. And our concern is that a lot of the symptoms of these conditions can be silent. So you won't know that you have something like this by looking at you or the way you feel. And our most recent campaign really is about, and particularly for the over 55s, as we get older, is to own it, check it, sort it. So be proactive and take responsibility, as you were talking about, for your health and well-being. Know your risk factors, engage with your health professional, and then take control, you know, with the appropriate action to keep your heart healthy for longer, because it has such an impact on your whole, keeping you, you know, away from chronic disease in many ways. The good news, as Brian was talking about, is at least 80% of this kind of cardiovascular disease is preventable through lifestyle changes. And understanding what your risk factors are, engaging with your healthcare professional, making those small changes is really, really important and can have a significant effect. Targeted health promotion, I suppose, is really about, for men, is making it easy for men to engage, because, as you've said, they're not the best at engaging in doing it proactively themselves. And we have been a bit limited from a Croí perspective about getting out there and engaging with men and doing those screenings. So this is an opportunity to highlight the kind of things that need to be done. And as you've all alluded to, it is about, you know, making that engagement, knowing your numbers, knowing what your blood pressure is and your cholesterol. If you're a smoker, time to stop now. And obviously, if you're not a smoker, don't start. Being physically active, as everybody has said, and having a heart-healthy diet will help to keep your weight under control and prevent or control diabetes. And then, as Brian was saying, it's about making health a priority. So setting realistic goals for yourself, giving yourself those positive reminders, managing stress, and learning to relax, as Paul was talking about as well. So healthy aging really starts at a younger age. It's not about waiting till you get to a certain age before you do.
Sure.
But I
Thanks.
suppose it's about recognizing that the potential and not seeing it as a challenge, and remaining engaged and continuing to be positive about it.
Thanks, Trish. I mean, I think, as everyone has said, it's perhaps relatively small changes that people can make can have a huge impact on their overall health. So thanks very much to everybody. As I say, very interesting perspective, and good to get the GP perspective, the former sportsman. I'm going to hand back now to Paul. Maybe just try and, Paul, wrap this up in terms of just a reminder back to everybody about the importance of Men's Health Week, what men need to do, the themes of the week, etc. Thanks, Paul.
Thanks, Pat. Yeah, no, just some of the key things there that kind of stood out for me was just the importance of actually accessing your GP or talking to your GP about any health concern. And possibly the thing about that is to frame that as a positive thing, an actual brave thing to do, as an act not only of self-compassion, but an act actually for those who you care about. Because, as we're all saying, by actually talking to your GP, who are so receptive to meeting people, you're actually keeping yourself well, which in turn will allow you to look after your loved ones and so on and so forth as people age, as Trish has just said. And the other key thing was obviously the earlier that something is actually detected and looked at and treated by your GP, it's much easier to actually deal with it rather than leaving it for a long time where the prognosis or the treatment can become a little bit more difficult. So that's critically important. The other thing which Liam kind of alluded to, the importance of kind of maintaining a healthy lifestyle. And that healthy lifestyle doesn't have to be a whole new regime. Small changes can make a huge, huge difference. Even in terms of physical activity like that, 30 minutes a day, 5 days a week, reduces your risk of 35 chronic diseases, which is phenomenal. I mean, if you could bottle the benefits of physical activity, you wouldn't be able to buy it in the pharmacy. But from a physical perspective, from a mental perspective, and Liam spoke about diet and about sleep patterns and stuff, and being connected to when you're out and connecting with people and being active. All of that is wonderful, and it really, it helps people to look after themselves long term. And then the other thing, just before we go, I'd like to introduce, there's a man manual here that has been produced for Men's Health Week, and that's available on the menshealthforum.org website. People can download it, and it covers all the lifestyle issues. And I know Croí have probably plenty of material as well. So please access those, as well as the links that we're just going to put up now. There are websites, there are links, there are support services for men. We would all probably strongly recommend that men just tap into them, use them, because it's only small steps can make a huge difference.
Thanks very much, Paul.
Thank you to everything for actually listening to us and for taking the time to participate in the Zoom call.
Thank you.